Hey, it's Dr. Brian McKay, not just a chiropractor. And today, of course, we're going to always somehow circle back around the chiropractic. We're going to start with something a little bit different today. It's going to be how migraines are treated here at Core Health in Darien. And one of the things we've seen is the effectiveness of pre and postbiotics. And that's what I'm going to hopefully deal with today and give you a better understanding of how that works. So we have what's called the gut-brain axis, okay? They're tied in very, very heavily together, okay? The stomach is where you produce 80% of the immune system. And obviously the brain needs to be aware of that as well. So it's a very important thing. So some of the research on prebiotics and probiotics, say that 3 times fast and see what happens to you. They kind of recondition the microbiome, okay? And it kind of reinforces the gut barrier and it helps build the mucosal level in the intestines. And this has been shown to reduce migraine frequency and severity. So that's a pretty good reason to pay attention to stuff like this, because if you get a headache, and I do treat a lot of headaches, but listen, I'm not going to fix every headache with just a chiropractic adjustment. And if you think Botox is going to cure, Botox doesn't cure anything. It's just pretty dangerous to do. But just to go over some stuff, there's some studies going, and if you want, I can provide the actual study name, but 40-45% reduction in the largest double-blind study of its kind, taking multi-strain live bacteria, saw a 40% reduction in episodic migraine attacks and frequency. That is a pretty significant drop, okay? So that's it's just one of the things. Now, another thing too is a 12-week trial, which is a different study. It's only 69 women in this one. It showed that symbiotic supplementation, meaning probiotics and prebiotics, reduced migraine frequency to a placebo. Okay, so you're talking about a big, big change. I'm going to throw this one in too, because this is something, if you're not taking it, vitamin D is one of those miracle supplements you got to be on. I would suggest that you don't go to Costco or Walgreens to buy it, or Target. A good vitamin D is very important, because if they've studied, again, this is a 2004 study, so it's not that old. And if you take the vitamin D with the prebiotics and probiotics, you also see like a 3.17 reduction in monthly headache frequency compared to only 1.25 in the placebo group. So that's the number of headaches a month. So you really want to limit your headaches. Is it going to kill you to take a prebiotic and a probiotic? Because right now, I think it's a very easy way to ensure a more beneficial result when it comes to treating migraines. All right. Just listen, some people can get better with just doing the chiropractic adjustment. Fine. But I think this leaky gut thing is a lot more serious than most people realize. And that's a pretty, So again, with these different protocols, I adjust certain areas. And again, that's the chiropractic side of the treating side. But I'm really starting to understand that it's a big, big thing. And also, too, is I don't think supplementation is that expensive. Okay, if you consider what you're taking on medication, it just covers it up, and what it does to your body, I think it's a pretty good idea to start taking, And also, too, is I'll throw myself under the bus. If prebiotics and probiotics are enough to help minimize the headaches and help you get better at avoiding headaches, that's a great, you don't have to come see me as often. All right. Which is, listen, I understand people, with the chiropractic care, my chiropractic care is not expensive by it. It's actually, I'm sorry, is expensive, but it's necessary in many cases. And then what happens here is if we can reduce the need to see me, I'm not upset about that, because that means one less headache. It also means that I was successful in helping you out. So I'm okay with that. And I think, but again, the idea is taking a prebiotic or probiotic. I'm almost to the point where I think I'm going to hold off treating patients for a month and make them go on a prebiotic and a probiotic, just to make sure that they're getting the right nutrition they need. So there's enough studies going on, that would indicate why it's important, to total gut restoration. Again, you're going to reduce leaky gut, which is leaky gut that there's channels because you have different layers, and the outer layer opens up in your intestines and it leaks out what's called lipopolysaccharide. And when you have a lipopolysaccharide, it's going to sensitize pain receptors, the trigeminal nerve, which is linked very heavily to headaches. Okay, that's the thing is, a lot of times, say, oh, we don't really know what's causing headaches. The trigeminal nerve is a big, big player. Okay, very big player in headaches. That I think that's one of the reasons why chiropractic care is so effective, because we affect changes there. But another thing I want to point out is, you may not be aware, but serotonin is a neurotransmitter, and what happens is serotonin regulate pain signaling. Okay, nerves carry the pain. Okay, it's not, so that's please understand that the nerves transmit the pain impulses, and 90% of serotonin is produced in the gut. So when you start taking a more natural, holistic approach and start working with it, I think you can see some really important gains in the quality of your life. So which is, to me, very, very, So the other thing too is the probiotics are important, and the prebiotics in the intestines, but it's for your immune system. 80% of the immune system is in your gut. Okay. So as far as inflammation, which I'm sure you've heard about how devastating inflammation is, that's an area you really should be paying attention to, because when you have when you have inflammation, you're going to have what's called a cytokine and a pro-inflammatory, which means the cytokines, and cytokines are good in the short term. Chronically, they're not. They're very, very devastating to a person's overall health. So what happens is, when you have the total gut restoration by using the prebiotic and probiotic, you're going to help modulate these pro-inflammatory cytokines. And when those cytokines are elevated, it's linked to more chronic migraines. So I think I've bombarded you with enough information for this beautiful Friday. But the idea here is, if you have headaches, I think you should take what we call the double barrel approach. Hit it hard. Get the right supplements, because there's no downside to taking probiotics. And typically I would put someone on a 3-month program. And the good thing is, it's really not that expensive. I think it's actually a reasonable price. And I'm not here to sell you vitamins or supplements, but there are certain ones that I do believe work and can see great results for my patients. And, for the last couple of months, we're basically making sure people will get supplements if they're going to come in for migraine care, because it makes me look better if you get rid of your headaches. And there is a bit of an ego here, because someone comes in with headaches, I want that person to get better just as much as they do. A little feather in my cap, but again, this is not about me. So, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. It was a pleasure talking to you today. I hope you learned something. If you have any questions, 203-656-3636, 203-656-3636. All right, thanks, and have a great, great day.